Namaskar. You want the hair transplant. You love to have hair on your head, and that's everyone would like to have. And you got your hair transplant done. But nobody will like to have any side effect or complication out of any cosmetic procedure. Of course, hair transplant is a surgery and anything can happen in any surgery. But hair transplant per se is a safe surgery, and the complication, especially life-threatening or any major complications, are very rare in this. It's a surgery which is done as a daycare procedure under local anesthesia. Patient is fully awake, he is watching movie, taking lunch, breakfast, drinks and all that, talking, listening the phone, and everything is normal. So the chances of complication in hair transplant is very rare. But mind it, it's a surgery, and the hair transplant should be done by a well qualified, trained, registered medical doctor. Only he can do the hair transplant, that too after a training. So let's discuss today what are the rare complications or what are the problems which you may face after the hair transplant. Although it is very rare, again I am repeating. So complication can be in the form of two. It can be in the form of a complaint, or there can be complication. And complication can be surgical, medical and the aesthetic. The complaint can be, let's discuss the complaint which are minor problem. They are temporary for some time only and they disappear by their own, like the itching. Because of the dryness in the scalp, or you are not washing for 3-4 days, so the itching is the one of the common problem, but you can just dab it, or usually surgeon gives a antibiotic solution or a saline spray, so when the scalp become wet, then the itching is reduced, and sometimes you can apply also the coconut oil. Second is the pain. Although in FUE technique the pain is very less, so as in FUT also, but there can be little pain, and every surgeon advises you for some analgesic tablet for 2 and 3 days, but pain is in tolerable limit. Then the edema. Yes, many of the people are worried about the facial edema. Edema, what happens when you are implanting, you inject saline in the recipient area to expand the area so that you can put more graft into that. After surgery, if you lie down facing to the bed, or you bow down like this for the longer period, whatever the saline was infiltrated here, it comes down to the forehead, then eyes and all that. Then there can be swelling. But if you lie down facing to the ceiling for 2 days, the whole of the saline will go on the back side and there will not be any puffiness or edema of your face. Surgeon usually explains you. And this edema, mechanical, it is not because of infection or it's not a serious problem, but certainly it becomes embarrassing when you have your face which is swollen. Many times patient says his friend's face become like a football. No, I don't think so. There is so much of the swelling. There can be swelling by mistake if you don't take a proper posture, and that goes in 3 days. Then the uncommon problem can be the graft dislodgement, because for initial days the grafts are weak, and if you scratch, you hit your head accidentally, then the graft may come out and there can be some bleeding. If it happens, then you just stop it, but again it's not a serious thing. Then hiccup. Yes, hiccup can be a very rare problem and that subsides by its own. If it doesn't, then you must contact your doctor, surgeon. He will advise you some largectic tablet, and 2 or 3 tablets the hiccup disappears. Then the hyperesthesia. Yes, this may happen in the donor area mostly, and there can be hypoanesthesia in the recipient area. See what happens when something has been done to your part, some body part. Brain thinks it is disease part, and sometimes the brain doesn't carry a message, or sometimes it says things that it is very painful. So you need to touch that part which has got less sensation or high sensation. Donor area, there can be some hypersensitivity. For that you must rub that area, so this problem disappears. Again, this is a temporary problem which disappears. And if you face, ask the doctor. Then the folliculitis, yes, this can also happen sometime, rarely. They are small follicles, there can be redness in there, and very rare they become infected, which is allergic or reactionary. So hot water bath or hot, if you do fermentation, those disappears, and you must contact the doctor if you face. So these were the minor complaints, and they are temporary and they disappear by themselves, but you must consult your surgeon. Medical problem during surgery. So most common is the vasovagal. This is the most common problem which sometimes we see when we go to hospital, when one of our friend, he is donating the blood or blood is taken for the investigation, then we may fall. That is called as the vasovagal. Means shock lag gaya. That's what we call is the shock lag gaya. And sometimes the black out happens in you and you fall down. So it's also a common problem. Sometimes it may happen 1 in 200, 300 patients, but doctors take care of this, and they, while injecting any medicine, local anesthesia, the doctors are talking to you and taking care. So chances of vasovagal are very rare, and even if it happens, it's a very manageable situation, not a serious problem. Hypertension, if your blood pressure before surgery is not taken care well, then during surgery there can be increase in the blood pressure. Drug interaction or the allergy, this can also happen, although very less number of drugs are being used during the hair transplant surgery. Surgeon knows it. So, but any drug can cause the reaction, although chances are very, very rare. I haven't seen in my so many years of the life. Cardiac event, yes, cardiac event may happen if you have some existing disease. Otherwise, per se, because of the hair transplant, because it's a safe surgery, you are fully awake, not a major surgery. So cardiac events are also very, very rare. Then the surgical problem during the surgery, can be the bleeding. It is very, very rare. I don't think so there are any chances of bleeding. After surgical, means after finishing the surgery, there can be the necrosis, infection, and the wound dehiscence. Most commonly wound dehiscence happens in the FUT cases. If surgeon has taken a wider strip and he put the sutures under tension, then the wound may gape. There can be infection also, and there can be slight necrosis, means some part of the scalp may become black. So that we call as the necrosis because of the compromised circulation. Chances are rare. Then the aesthetic complication. Yes, these complications are common. If your surgeon, your hair transplant, not done by a well qualified, well trained, registered medical practitioner, because nowadays many of the hair transplant are being done by the technicians. Many of the transplant are being done by the untrained, unqualified. Hair transplant surgeons, they just go somewhere or they watch the YouTubes and they start doing the hair transplant and put a big signboard that they are the best hair transplant surgeon in the world. And you don't know. So if they do it, then their aesthetic complications are very, very, very common if it is done by untrained person. Then the poor growth is the reason is the same. If either you had some existing problem which were not taken care before, or your surgeon was untrained, he did not took all the precaution which should have been followed, then there can be the poor growth. Means 3,000 grafts were put and only few 1,000 grafts give up. So this is again a serious problem, most commonly done by untrained person. Now this is the aesthetic complication. I'll call it is a disaster. Some surgeon who was not knowing the aesthetics of the hair transplant, he put the hair in this area. So very commonly what we understand that in childhood we had the hair here in this area, and when we go to the surgeon we tell them please implant and make this area. And if surgeon is not skilled, he doesn't know the ABCD of the aesthetics, then he will do what the patient is asking, which is wrong because patient doesn't know. So in that case he implants the hair in these two angle, frontotemporal angle, and then because the hair loss is a progressive process, so you lose hair on the back side, and and it becomes empty space and it looks unaesthetic. So this is a disaster, I'll call it. Should not. Now what way hairline should be made? They are a fixed principle of making the hairline. I did this case, I designed it, I did not put it low. If you put it low, then it becomes abnormal. You should not make it obtuse, it becomes the acute angle. It should be designed in such a way that hairline should be soft, pleasant looking and natural, not harsh. Weak hair, single follicular unit should be put. One has to understand the aesthetics of the hair transplant, then and then it should be done. Now see, another disaster. The hairline, very poor density, multifollicular units has been put, all hairs are going in different direction. It's looking like a cap. So again, it should not be done and done by some untrained person. This again, the low density, irregular hair, multifollicular unit going in different direction. So it looks poor. Again, the same complication. So it should have been like this. See, again, poor, very poor result. So then this is the necrosis. Because of too much of density given by untrained person or too much of the trauma created during creating the slits and implantation, then there is a compromised circulation and there some part of the skin may get necrosed. Usually, but sometimes many of the patients, the cause may be idiopathic. Very rarely, or patients are heavy smoker or high diabetes, uncontrolled. In them, the circulation is compromised, and in such cases, there can be partial necrosis. And in very rare cases, existing cause is not known, but still the patient may have a very minor patch of necrosis which heals by themselves. This is over-harvesting, means more number of the graft has been harvested. Sometimes there can be the economical reason, surgeon wants to earn more and more money. Sometimes the patient asks, he put as number of as graft possible. Surgeon is not having the knowledge. What is the safe excision density? Means how many grafts should be taken out in one go. So he removes the eczema and this becomes the bald and the empty. So to cover one area, you have made another area uncovered. So you have created another aesthetic defect, which is again a crime, and it should not be done. But a trained surgeon is there who is qualified, experienced. These complications which I enumerated are very, very, very rare. So hair transplant per CLC is a safe surgery. These are the procedure done by me, 2,896 cases at Rejuvenate Hair Transplant Center. None of the patient has any serious problem, any life-threatening complication or any serious complication except numbness, hyperesthesia, something like that, but no one had any serious problem, and these are our data which have been developed recently. My paper has been published in Journal of Plastic Surgery. You can see in that surgery. Hair transplant is a safe surgery provided done by qualified, trained, skilled, well-trained surgeon. So whenever you are searching for a surgeon, you just see his qualification, see his associations, see his academic, see his testimonials, see his website, results. Go to him, talk to him for everything in detail. Ask him whatever you want to ask, and then you go for the hair transplant with him. Thank you very much.